Hi, this is Rashni, and I'm going to present my strategic plan about centralized telemetry. So the strategic goal that I had in mind was to convert from a decentralized telemetry monitoring system to a centralized telemetry monitoring system at Advocate Lutheran General within 2 years. And this is in light of increased safety events that have been related to telemetry monitoring. So the stretch goal would be to convert all 12 hospitals within Advocate Healthcare in 5 years. There have recently been events, about 10 at Lutheran, and every other site also has had recent adverse events related to telemetry, and so the centralized telemetry would be a great strategic plan. A little bit of background information, like I mentioned already, that there's been an increased report of adverse events. And with those adverse events, the length of stay increases, the cost to the hospital increases. This also directly impacts reimbursement rates. It causes patients to be dissatisfied, and then patients are also dissatisfied during the transfer process, and instead of that, with the centralized telemetry, we could have admissions based on diagnosis. And right now, besides our ICU units, we only have 3 other units that have telemetry capability. So in order to go on with the strategic plan, we did a little bit of a SWOT analysis, and some of the strengths of Lutheran General and Advocate as an organization is that it is one of the top 100 hospitals in the nation. Recently, we have merged with Aurora Health, which is in Wisconsin, and they have 3 hospitals that already have a telemetry monitoring hub. Our main concern is safety, and we are a high reliability organization, meaning we don't want zero adverse safety events by 2020. This would also mean that there would no longer need to be, nurses would not have to escort patients that are on telemetry to any diagnostic tests. Weaknesses are that we have increased adverse events, the fact that the nurses have to accompany the patients. There's also alarm fatigue. There are lots of alarms, phone calls, all kinds of tones that go on in a hospital unit, which can cause a lack of getting the ability to hear the telemetry monitoring. And then we also need a standardized criteria for telemetry, which this is regulated by regulatory bodies, and the regulatory body that oversees Advocate as a whole is DNV. There's also JACO, Joint Commission. Some opportunities. This would allow all the hospitals or all the units to have telemetry capability. This would mean that we're being in line with advancements in technology and wireless capability. We would need to hire a new workforce of the telemetry monitoring technicians. And then we would also need to educate all our employees and new hires on how centralized telemetry works. Some of the threats, so to have a competitive advantage, hospitals need to be up to date with all their technology, and the competing hospitals, Northwestern Memorial, has already been functioning with centralized telemetry since 2010. Cleveland Clinic is a large multi-system hospital, just like Advocate Healthcare, especially with the new merge, and they have shown positive results and less technical errors. Just to give you a few numbers, they have increased their successfully resuscitated patients to 93%, and they have been able to increase their numbers of impending arrests from 79% to 84%. So this is just a strategy map to see how everything is connected. Whenever there's a strategic plan, you want to work on financial performances, customer service, internal business process, and learning and growth. And you can see how the arrows go with each other to see what is going to work overall just to provide high quality, safe care to all our patients. The action plan would be to review all the safety events that are related to telemetry via our report data entry system. I would definitely want to form a steering committee that had nurses, managers, physicians, and clinical educators. We would, with the steering committee, standardize the telemetry criteria as well as discontinuation of telemetry. We would work with human resources for a hiring process and creating a job description for the telemetry monitoring technicians. We would also have to work with finance to figure out the costs for hiring the new techs as well as the cost of the centralized hub. And the clinical educators will provide courses, instructor-based courses for new nurses as well as our new hires and the existing nurses on the process change as well as the new telemetry standards. And the way that this will all be communicated to the hospital, the organization, would be to start with this PowerPoint for the executive team. From then on, we would disseminate information to managers and committees, which would include our shared governance council, which is highly nurse driven. We would also include it to our high reliability units, our manager meetings, and physician meetings. We can provide updates in the form of SBARs that already exist. And then we also have weekly RN need to know emails, which we can update every week on the process and then when it is finally in implementation. There would be a need to minimize any grapevine communication because, as you know, rumors are bad and negative. And so in order to do that, we would just be open and honest. We would allow for any feedback from the nurses. So this would be participatory communication. It'll help the nurses and the staff be more engaged in this initiative. The evaluation plan would be with 3 different controls. We would definitely have to have a financial control to see the financial burden related to telemetry failures. And then with that, how would we balance the cost of the telemetry hub with how is it compared to the adverse events? Which one is costing more? The feedback control model would help us to compare the number of adverse events that we had a year prior to implementation, and then I would want to compare it to 3, 6, 9 months post-implementation. And this will just help us see and measure our performance. The total quality management kind of is the broadened term for the entire project, which would include teamwork with the steering committee, working with the nurses and doctors. It will help decrease costs overall, and in the overall effect, it will help increase customer satisfaction. So as you can see, when you compare a decentralized telemetry to a centralized telemetry, you see there are some positive safety outcomes. It can help decrease adverse events. It can increase quality care and patient satisfaction. And since we are on a high reliability organization journey to having 0 serious safety events by 2020, converting is directly aligned with that specific goal. And you can see that the cost that might increase with having a telemetry hub and hiring some new telemetry technicians, they kind of outweigh the harm that we cause to patients with the decentralized telemetry. I thank you for your time. If there are any questions, please feel free to ask, and I will just follow up with the 2 reference slides for this. Thank you so much.